Welcome to Beyond Wealth, Success Unscripted with Matt Calnan. Discover the personal drive, professional journeys, and business strategies that have made a real impact. It's success from the inside out.
Welcome back to the show, everyone. Today we're chatting with Ash Anwar, the co-founder and senior director of data at Molecular U. With over 10 years of experience in health, wellness, data analytics, and AI, Ash directs innovation and strategy for cross-functional teams. So first of all, welcome to the show, Ash. And why don't you start off by telling us a little bit about yourself and what you've been up to?
Yeah, it's a pleasure to be here. I'm excited to talk about, and have our conversation today. So as you said, I'm Anwar. I'm, directing kind of the data and AI activities here at Molecular U, and primarily what we're really involved in is trying to predict disease ahead of traditional clinical medicine, basically. So before symptoms arise, before it becomes a concern, we have models that we have that look into all the molecules that exist in our blood to make predictions 5-10 years ahead of time to say, hey, you're trending towards this disease. Maybe you need to take some corrective action today before it manifests into something far more significant down the road. And so we've had a number of really great projects so far. We've had this amazing project where we were able to detect pancreatic cancer at stage 1 for an individual who's been with us for a really long time. Yeah, it was super exciting, and she's doing really well. All she needed was a surgery after the tumor was kind of detected through our systems, and we kind of handled that through her physician. No chemo required kind of thing, and she's doing really well. And now she'll be part of our ongoing kind of monitoring system to make sure that nothing resurfaces. And then a number of other things that we do, especially around neurological disorders. So right now we have a major project that we're working on early detection of Alzheimer's disease. And then we have another project that we're working on detecting autism earlier in children. So usually autism is very behavioral. We're looking at trying to use biomarkers in the blood to detect it as in children as young as 1 to 2 years old.
Wow. I mean, you guys are obviously on the kind of on the leading edge of everything that's going on there medically. Can you explain, and probably not in the context that you explain with the people that you work with, but explain to me how that actually works? Like, what are you actually doing to get these tests and to try to have these detections?
Yeah, well, I mean, if you've ever gone to the doctor before and gotten a blood test, like usually what the physician is looking for is kind of these few tried and true golden biomarkers, as they call it, in the blood, right? So you go in, you do your blood test. Maybe they're looking at your sugar levels, for example, or you're looking at cholesterol or some liver enzymes or something, right? Usually a handful of things. Very often these specific biomarkers only become abnormal once you have quite a bit of a disease process already, right? So in the case of like fasting glucose, for example, once your body's lost control of being able to regulate sugar, you're well on your way towards becoming diabetic, right? You usually
Right.
at that stage pre-diabetic, right? But what we do is there's hundreds and hundreds of molecules in the blood that aren't traditionally analyzed by traditional medicine. And so when you look at these biomarkers, a lot of them are of the earliest stages of disease. So before your body even loses control of being able to regulate sugar, you have these things that kind of crop up in your body, like losing the ability to inflammation in the pancreas, for example, damage to the blood vessels, for example. These early indicators of damage and systems kind of moving in the wrong direction. And those are the biomarkers that we kind of can pick up. Currently, we're kind of looking at 250 biomarkers in the blood, but we're looking to expand to well over 800 to 1,000. So we're going to have a huge, massive kind of panel of these biomarkers to help us look at these early stages of diseases. And what me and my team have done is we've developed models, specific machine learning models that allow us to predict disease based on these biomarkers. So if there's a certain profile biomarkers that kind of become abnormal, we can compare these profiles that we know would progress to Alzheimer's disease, diabetes, cardiovascular disease, and compare it to an individual who has come in. So we'd take your blood, we'd analyze it through our systems, We look at your profiles of the biomarkers and then compare to this library of predictive prediction models to then give you information as like, okay, you're matching up with this type of disease trend. You may want to consider doing something about it. And then our system also provides targeted actions. So targets like dietary, exercise, supplement actions that'll say, hey, we have scientific evidence that shows that if you do this type of, if you are on this type of diet and you're primarily eating these types of foods, this has been known in the scientific research to lower those levels of that biomarker or those groups of biomarkers. And then we'd recommend that to you. And hopefully on that system, you follow those actions, and then we can retest. And so we've done that before where we've seen individuals have been recommended a specific diet. Usually what happens is they get recommended that diet, they don't follow it originally. It's very difficult to actually make those changes. They come in for a second test 3 months later, the system doesn't change. They're still at a very similar level of risk. And suddenly they're like, okay, I need to be a little bit more serious. And then they actually go and make those changes, like cutting out red meat or reducing alcohol intake, or, adding, eating more nuts, for example, as a specific recommendation. And then on the third test, that's when they actually start to see quantifiable change in the biomarker. And they're like, oh, wow, this was my inflammatory biomarker was really highly elevated. And now all of a sudden it's normal. And, we've had clients come up with us and be like, oh, I just feel better. I don't know what it is. I haven't really lost weight, but I feel better. I have more energy. And ironically, if you're on the system long enough and you're following these actions, a side benefit is actually weight loss as well. So you have clients been on this for a year and they're just like, my focus wasn't on losing weight, but because I'm eating healthy and doing these things, all of a sudden I've also lost 10 pounds. So it's quite a powerful thing when we look at something very deeply like that.
Yeah, yeah, that's really fascinating. Um, when you're looking at those markers, you're still like drawing blood, it goes to the lab or whatever. And then is it AI that's doing the comparison against the models? Is that where you're using AI in your system?
Yeah, that's correct. That's correct. So with AI, what we'll do is it enables us to always, so AI enables us to do a couple of things, right? So we're using AI to help us build these robust models, not only for specific diseases, but we're always kind of working towards um, expanding these sets of, like, I would say, health conditions that we're looking at, right?
Yeah,
So
yeah.
that's AI helps us create these models, helps us create these profiles that allow us to do that. The second thing that we really use AI for a lot is always kind of scanning the scientific literature. There's millions of papers that are published yearly in in medical journals and scientific journals, and we always want to keep up to date with the latest medical research that's out there so that we can provide the most cutting edge piece of information. And a lot of times, even with these scientific publications, sometimes there's controversial papers that come up, right? Someone suggests that this biomarker is associated with prediction of a certain disease. We want to make sure that our AI systems not only pick that up, but we have scientists that are looking at it, like myself, to also judge whether or not we implement it into our system or whether or not we kind of hold on to it and allow the AI to search for additional supporting pieces of evidence before we put that in there as well.
This is very fascinating. I mean, AI is obviously big in the world today, and I would say probably over the last year and a half, it's kind of gone leaps and bounds. But like I use AI to make up songs about my kids, and you're using it to save humanity. So
That's being it's just make the world kind of a better place, I guess. No, for
yeah,
sure.
yeah. What's the commercialization of this? Like, are you guys, do you have clients that are paying money for it? And if so, like, what is that structure looking like? Am I an individual? I can go to you as a company and say, yes, I'd like a membership, or I'd like a test done, or
Yeah, no, it's a very good question. I think we have two primary models here. Specifically, if you're in Canada right now, we have a direct-to-consumer model where if you're interested, you can actually contact the company and we'll ship you out a kit, which you can take to a blood collection kind of lab. And then they'll do the whole process and the data will be analyzed and your report will be sent directly to you, which is both available on kind of a web portal. We also have a mobile app, and also through the web portal, if you want to download like an actual physical copy, like a PDF report, that's also available. So we do have kind of this direct to consumer model where it's very much private pay, right? So
Mhm.
pay for it yourself, you get the results and everything like that.
Yeah.
And then there's also health coaching that is included there, where someone is there who can actually help you interpret your results. One of the big obstacles we found is that not everyone is a biochemist like myself.
Yeah.
So it's very difficult to understand the implications of certain biomarkers and things like that. So it's nice to have kind of a knowledgeable person to help you understand what your report means, but also being an accountability partner to help you follow, certain healthy habits and improve on your health and things like that. So
Right.
that's one model. The other model, which I think is a very it's a very powerful model, is really what we're doing in the US, which is we're going directly to clinics and we're interfacing directly with the physicians and saying, hey, we have this test. It's going to provide you with a list of 250 biomarkers. We have almost 30 diseases and healthcare systems that we are looking at. We can provide you with this unprecedented look at a patient's health earlier than what other tests that you may be running. Let us partner with you, and then let's run you through the system and get some patients that you want to go through the systems.
Yeah.
And that's been very successful for us in the US, and being able to partner with several clinics, particularly in the functional medicine space, um, particularly in clinics that are doing a lot of healthy aging and longevity, and as well as some really private clinics as well, where just people are just interested in getting a deeper look at their health. So this
Yeah.
whole clinician model, this clinical model, has been another kind of really great business model, where the obstacle again is like, physicians aren't traditionally taught in this way to look at health. So we're also kind of working on an educational kind of system to get them to understand that, hey, what does risk of diabetes mean, or risk of a chronic disease mean, versus like actually like having that symptom and diagnostic confirmation and then moving towards medication. Like we're playing in a space that's like more proactive than what traditional medicine is, which is very reactive, right? Symptomatic
Yeah.
based. Something goes wrong, give them a medication to fix. We're really playing in a lot more of an earlier space and being like, hey, let's keep you healthy for as long as possible as we can. Let's identify disease before it happens. And if for some reason you end up in that disease process, well, at least we have medications that can be targeted to that. And with the metrics that we look at in the blood, we can also tell you if a medication is working effectively or not. And that's been really useful for physicians to kind of track, like, hey, I've given this medication to this individual. Has it been working? Has it been reducing their risk of this
Mhm.
disease? If it's not, quickly let's switch to a different medication, things like that. So it's been very, very good in that business model.
But yeah, that's interesting. And is the model differences between Canada and the US, I assume, is just because the differences in healthcare systems where US is private based, Canadian is public based. Is that fair?
Yeah, I would say that's pretty fair. I think the appetite for healthcare is a little different as well. I think in Canada, when we started, we've interfaced with the government a lot to kind of talk about like, hey, this is a really good. I mean, in terms of dollars and cents, it makes a lot of sense in my opinion.
Mhm.
The population's aging. As people age, the incidence and risk of chronic disease goes up. This is going to become a big health burden on the healthcare system.
Yeah.
Why not cover certain costs of this test, so that people can at least do this test and kind of ward off getting into this chronic disease. And especially like diseases stack on top of one another. Like that's the key thing too, right? If someone is, say, let's moving towards and becomes obese, for example, right? Obesity becomes an issue. Obesity will then lead to diabetes, cardiovascular disease, which then stacks on top of more issues like kidney disease, liver disease. So a
Yeah.
lot of diseases, once the disease process has started, cascades into just multiple issues, and which is incredibly costly to the healthcare system, right? So
Yeah.
we've talked with the government to kind of cover aspects of the test, but with the government here in Canada, it's a little slow, and you really have to you really have to point out the benefits. And
Yeah.
of course it's like it's slow going, but so far we've been successful on the private pay front for people who are interested in this and have the capability to pay for this type of test. And they've been interested in making sure that, their health is something that they take care of, right? In the US, of course, the appetite is completely different in the US. If you And I was in Boston for a year, so I have had some experience with having the U.S. healthcare system, going into a hospital, how costly it is when
Hmm.
you have a health scare, or you have an issue with your healthcare. Just to see a doctor, it's very costly. So the appetite in the U.S. For something like this is very different. People are
Yeah.
really looking for this, and it's a much, I would say, obvious kind of sell in the US to people, where it's like, hey, if you have a heart attack, that's going to cost you quite a bit of money.
Yeah.
But if you do this test, which is a fraction of the cost, which is of treating you if you had a heart attack, you can actually figure out if you're at risk of this and actually take steps while your body is still capable of recovering or slowing down that process, or even completely warding you off from that risk of a heart attack. Like, we could do something about it earlier
Yeah.
rather than
Yeah.
later. The cost is significant.
Yeah. Yeah, and I would think whether it's on the Canadian side or the US side, like to your point, it's got to make economic sense for things to happen most of the time. But I think, and I could be wrong on the step. Somebody told me one time that, say, to treat a cancer patient, which is generally quite a long treatment, is upwards in the Canadian system, upwards of $200,000 a year.
Yeah.
Sorry, $200,000
Mhm.
for that treatment. That's a lot. So
Yeah.
now, if you look at from the Canadian healthcare system, which is provincially run, so say Alberta Health, I would think they could then look at that cost benefit, saying, well, if we implemented tests that were more upfront with the results, here's what the benefit's going to be on the back end by not having to treat those people the same. And
Mhm.
no different than what you're saying in the US is, if I'm an individual, I'm making that determination, or that choice on my own. We just need, say, the government bodies to also make that up here.
Correct. Correct. Yeah. Well, I think it's completely the case, right? You got to make the economic case for it, that hey, this is
Yeah.
the cost benefit of this is better for you. I think the stakeholders are a little bit different as well. Like, I think in the US, the stakeholders to a person's health is primarily themselves and maybe their family physician and things like that. Here in Canada, I think the patient is a stakeholder, but a lot of it is also because it is so regulated by the government as well. I think the government is such a major stakeholder with the
Hmm.
doctors in here
Hmm.
as well. So it's not just about convincing. In the US, it's about maybe convincing the patient, and thereby they will talk to their doctor and be like, hey, I'm interested in this. And then there's also financial incentive for the doctor to prescribe a test, because there is it's a business model there, right? Versus in Canada, the doctors are kind of, they want to make sure that they're sort of the gatekeepers of, like, okay, if I'm going to do this test, and let's say hypothetically, let's take the cancer example. This is where things become a little bit, I think, more scarier, right? Like, let's take the cancer example. If let's say an individual wants to do this test, the doctor in Canada is like, sure, go ahead and do this test. They do this test, it comes up that we are identifying a certain elevated risk of cancer, right? Right now, we don't report cancers in our platform because of this reason. But let's say down the road, we decided that, hey, we're going to include something like breast cancer or something like that, because we have the biomarkers that allow us to look at this. So patient comes back and it's like, oh, I've got a risk of breast cancer, right? That's what it's telling me. And what we're detecting in the system is the potential of that individual's body to move towards a system where a tumor could develop, right?
Right.
Either
Right.
we're picking up early signs of that tumor, or a
Yeah.
system where tumor genesis or oncogenesis is favored, right? So the individual is obviously freaked out. They're seeing this risk. They go to the doctor, and the doctor sends them for imaging, right? Maybe they get really worried about this as well. And doctor's like, hey, let's go do a mammogram or something. They go do a mammogram, and then nothing is detected. Maybe the tumor's not large enough yet, or maybe, it's maybe a tumor just hasn't developed. They don't detect anything on the mammogram. What do we do at this point, right? Health
Hmm.
Canada is going to come down and just going to ask the doctor, I'm sure, like, why did you prescribe a test for imaging, which is going to cost the healthcare system, right, some money, when you didn't have any other, let's say, clinical evidence of this person having a breast cancer, right? So there's some like legal issues, especially with certain diseases, that we have to consider. Plus, there's also, I would say, a very critical thing, which is the do no harm kind of thing. At this point, the patient has been very worried about cancer, very worried about any other sort of disease. Like even if it's Alzheimer's disease, if someone gets a report that says, hey, you're at high risk of having cognitive impairment, like that's obviously something that's alarming, and we would
Mhm.
want to have the support of the system to support that individual so that they can understand what it means, take mitigation steps to prevent those kind of things. So it's kind of a really complex system, and when you dig in through the layers, it becomes quite a bit more complicated, I would say, right? So
Yeah.
involvement with the government, speaking with like the key stakeholders, like the physicians, like government entities, is going to be like absolutely critical as we move forward.
Yeah. Is this something where insurance companies would also be stepping up and saying, hey, I would rather pay for this test versus paying for this treatment down the road?
Yeah, it's really interesting you say that because I did my MBA about 3 years ago, I believe, and one of my big projects in strategy was about the company, like how do we strategically come up with a business model that would be like really effective. And this was before we were
Mhm.
targeting private pay and the clinical model in the US. So this is before our US expansion even. We were just playing in Canada. So as part of my MBA project, it was really around insurance companies. Like, hey,
Okay.
let's go in partnership with insurance companies because they want to make sure that with in terms of the payouts, sometimes with the way they assess an individual currently is through just like the clinical standard tests, right? And they're missing out a wealth of information in terms of understanding where someone is in their health, also just in terms of like renewals and monitoring someone, like how are they doing once you have your initial assessment and you have your insurance policy. You're not really assessed that much afterwards, right? It's just kind of like maybe there's a at the end of the term, maybe there's another blood test, but there's this huge blind spot for insurance. And so part of the strategy was wouldn't you want to know who's at elevated risk so you could adjust your premiums to adjust for that risk.
Mhm.
Or also in the longitudinal monitoring, maybe there's individuals who are taking active control of their health and improving their health systems. You could lower their premiums because they're becoming a lower risk for you. So this becomes a lucrative business model for the insurance companies that, hey, someone
Yeah.
is taking this test, they're improving their health, thereby saving them money. And the insurance company also knows that they're reducing the risk of this person having a catastrophic health event, right?
Yeah,
But
it's almost like dynamic pricing a bit, right? Where you can say,
yes,
hey, here's where you're at, but if you improve, here's what
yeah,
you be at, which is like the car insurance model today.
yes, yes, no, exactly, right, exactly. It makes a lot of sense, and so I would say we're in active talks. I think the thing is as well, like the industry really has to want to change too. Because when we were talking with the insurance companies, they were very happy with their current actuarial systems, right? The current stuff that they have built in,
Mhm.
they're really happy with it. And it was almost like it was an innovative way of thinking, but they were just not ready for that innovation yet. And I think what really changed the game was COVID, the pandemic, where all of a sudden, even with physicians, before the pandemic, we actually had, I would say, a bit of an obstacle talking with a lot of physicians where they were comfortable with the way that they were taught to diagnose disease, prescribe medications, things like that. And
Mhm.
even in the concept of telemedicine, for example, like that was not even, they were like, oh, I can't diagnose someone without seeing it. I
Yeah.
need to see someone, right? And so once COVID happened and the pandemic shifted multiple industries and it brought up all these innovative ideas, suddenly now you have the industry kind of moving and adopting newer and newer technologies like AI, as you mentioned. Now physicians and clinicians are more, I would say, accepting of trying to understand what AI can help them do. Right? There was a lot of fear in the past when I went to conferences and spoke with clinicians. They were always just like, "Oh, I'm afraid that AI is going to take my job," or the sentiment that, "Oh, an AI can't diagnose the way we diagnose," kind of thing. Right? So a lot of combative nature with AI, and I always tell them that you shouldn't be scared of AI. It's not that AI is going to replace you, it's the doctor who's using AI to supplement what they're doing that's going to replace you. So you should adopt that technology
Yeah.
and let it help you be even better at what you're doing. And so that sentiment, I think, has really risen after the pandemic, where people are looking at innovative technologies to do more, do more creative stuff, be better at what they're doing. And so suddenly the market has really opened up, and now we are talking to insurance companies about these models. People are a lot more concerned and want to be proactive about their health. That's why we've also had people who are now actively seeking these types of solutions to help improve kind of their healthcare as well.
Yeah. No, that's, I mean, it's fascinating that the science behind it is, I'm sure, very, very high level. Um, say for like a regular everyday person, I assume it's not cheap right now to get those tests done. It's probably not crazy expensive, but it's not, I would assume it's not cheap. Is there a point where as it gets rolled out more to the masses that price will continue to come down?
Yes, yes. I think what we rely on especially is that the economies of scale. So as volumes go up, there is the potential to lower those costs as well. And at the
Yeah.
same time, it's just like with any kind of innovative technology. When this technology first comes out, usually it's the early adopters that'll come in and pay that premium to have that test because it is cutting edge, or to use that
Yeah.
technology. But as the technology's costs come down and as it improves and everything like that, those costs are also would also be translated down as well. It's very similar with any type of technology, right? Like the laptop or computer, for example, very expensive originally, but through mass adoption and scaling and everything, the technology prices come down. And now having a computer, it's a very common thing. It's not something that is difficult to attain either. That being said, our test, I would say, is has also come down quite a bit in price as well, to the point where it's very similar to a lot of other private pay tests out there as well.
Yeah.
And I
Yeah.
think the advantage that we have is we are just looking at a vast more amount of biomarkers and providing just a vast more amount of information comparative to these other tests that are provided by these competitors as well.
Yeah. Well, yeah, and I know a lot of people that go down to Phoenix and they get those tests once a year, and it's more of like an in-depth physical kind of thing, and they're $5,000-6,000 US, maybe a little bit more now. That might be older numbers now,
Hmm.
but they're fine to pay for it. This seems like a much easier, less intrusive thing that you just have to go get blood work versus physically going down to some of these centers to do it.
Yes, exactly, exactly. And our costs are like a fifth of that as well. So
Yeah.
it's much more approachable price to be able to kind of do an assessment and have something similar to that concierge medicine type of approach.
Yeah. Yeah. This is obviously a big question here, but what's the future of this? Like, where's this going to take us?
I think that's a great question. It's something I think about all the time. I mean, I think one of the things that I'm really concerned with is our generation, right? The millennials and Gen Z generation as well. And I see a lot of articles that it's potentially the sickest generation we've had, right? With so many uh, potential illnesses and issues, not just mental health issues, but also the other issues with like obesity, diabetes, and everything. It really makes me worry about what happens as we age, right? How
Yeah.
much of a issue is it going to be to our quality of life and the systems as well? And so the future, really, I think, with Molecular U is really letting people take control of their health. I think this is where, for the first time, we're able to have unprecedented information about our health at the fingertips, and being able to deploy AI to it to help us, like, really guide us towards being really healthy. And I think, you know, we have a mental shift. Like, I once I became a father, for example, suddenly your mentality shifts and becomes like, oh, I need to be concerned about my health. When I was younger, it didn't matter. I'd go mountain biking, fling myself down a mountain, whatever, it doesn't matter, right? But now
Yeah.
I'm a father, and I'm like, oh, you know what? You know, wealth is really important as well. But alongside with wealth, you need to deal with your health as well. If you can be
Yeah.
healthy and increase your longevity, keep your body tip top shape for longer into the future, that is going to translate into your ability to also generate wealth, also generate get assets and resources to enable yourself to also have that whole generational wealth for your future generation as well. So
Yeah.
health becomes such a critical factor, and I that's where I think molecular U is the future. I think we need to. I would love for molecular U to become even more widely accepted as a way of looking at health in a more proactive way, and people taking action on their health, but also the healthcare system understanding that, hey, being reactive is not the approach we want to take in the future. We want to adopt these technologies that are very revolutionary and cutting edge, and we want to be more proactive in our health. One of the ways I like to describe molecular U is sometimes people ask me about, like, oh, what is molecular U doing? I like to describe it by referencing this movie with Tom Cruise in there, Minority Report. I don't know if you've seen Minority Report, but yeah, sometimes I say like molecular U is like the Minority Report of health. Like we can see what's going to happen in the future and prevent it before it's going to happen.
Yeah. Oh, that's awesome. That's awesome. Ash, if somebody wanted to take a deeper dive into this, learn more about it, connect with you, where would they go for that?
Yeah. You can. If someone wanted to learn more, they could visit our website at molecularu.com. A lot of our information is right in there as well. And if they wanted to reach out to me directly and have a conversation, I'm always happy to have conversations with amazing people like yourself or anyone who's interested in this kind of stuff. You can always reach out to me on LinkedIn. Just search for Ash Anwar. I'm available on LinkedIn and happy to connect and have a conversation.
Awesome. Well, certainly appreciate your time today. I do want to see if we can maybe do a follow up in 6 months or something like that, just to see what's happened and where things have gone. And yeah, it's you guys are definitely on the cutting edge of this the health society and the health system. So really interesting conversation with you today, and certainly wish you the best in the future.
Oh, awesome. Thank you. I appreciate that. Yeah, I'd love to. Things move very fast. So love to catch up again in 6 months and see where we are.
Awesome. Thanks very much.
Awesome. Thank you, man.
You've been listening to Beyond Wealth, Success Unscripted with Matt Calnan. Want to be our next guest? Visit beyondwealthpodcast.ca/guest. See you on the next episode.